What I'd like to do as the physician with my eminent surgical colleagues is really just set the scene first of all and just give a little bit of an overview of adolescent injuries, the issues that are involved, and just a touch on some of the particular injuries that we see. So what makes them vulnerable? Well, it's obviously the shearing forces that are going through the growth plates and also the traction forces at the apophyses, and particularly that vulnerability at growth spurts. We know that there's an association between peak height velocity and fracture rate. And why is that so? That's because there's a dissociation between how strong the skeletal architecture is and the expansion of the skeleton, and that is going to lead to weakness. The biggie, though, with adolescents is loading, and I can't, shout this loud enough. Have a think about what load they're putting through specific joints. And obviously, as physios in the room, I don't need to tell you about the muscle imbalances, leg length discrepancy, different range of motions around joints, all have their factors. And then lastly, the thorny issue of technique and coaching error. The other factors, however, that are key to any athletes, and certainly perhaps especially to adolescents, what are they putting in their body? Is their nutrition good enough to sustain the loading that they're putting through their body? Sleep is something that I think we don't ask enough about with all of our athletes, and there's a lot of interest in that at the moment. And obviously there are other stuff going on in their lives. They've got the other stresses going on in their lives with school work and relationships, etc., etc. So what effect is that having? And of course, when dealing with an adolescent athlete, you're not just dealing with that athlete. You're dealing with the parents, which can be challenging, and you're dealing with the coaches, which again can be challenging. What do we know about ACLs? It's a biggie out there. You only have to look at the states where they collect the data at high schools. There's a lot of ACLs going on. It is a season-ending injury for sure. However quick you think you're going to get your rehab, the season's over for that athlete. We know that it is particularly risky for injury for women. It's somewhere between 2 and 6 times more common. But it's particularly more common, it seems to be, in the adolescent female. There's a peak at that age range, whereas for men it tends to be a little bit older. And we know that whether you get it operated on or not, you're at risk of osteoarthritis. So the big queries are with the management of an adolescent ACL is, first of all, do you operate on them or not? How mature is this athlete? Have their growth plates fused or nearly fused? If they're nowhere near fusing, then you may well think about, actually, we need to hold fire. If you're going to go down the operative route, then that's where the graft choice becomes an issue. In that if there are nearly fused growth plate, you don't want to be putting bone patella bone through that growth plate and fusing the growth plate prematurely. Concussion is a big issue, particularly with adolescents, for various reasons. One, because the signs can be even more subtle than in adults. So one of the signs, if you're not aware, is, for example, being more emotional. Any of you with teenage kids, how on earth do you tell whether they're more emotionally labile than they normally are? Yeah. So finally, Physeal injuries, elbows. For me, we are now not designed to weight bear through our upper limbs, and yet our gymnasts obviously do to a great deal. And the thing that we see in gymnastics are these capitellum chondral damage. You've got to detect it early, and you've got to offload it early. Once you get a gymnast or any athlete that's got issues going through their elbow, then they're in trouble. And it's all about, can their body sustain the movements that they're putting themselves through? So it's all about their strength and control. Trampolinists put 13 times their body weight through their whole body when they're doing trampolining. That's something I had no concept of before doing gymnastics. It's a hell of a lot of forces going through your body. What I'm not really going into, but you know as well as I, that we do deal day to day with all of these, the Osgoods, the severs at the ankle, the Sindig glass, and again at the knee. for me, they're manageable conditions. They should never be so unmanageable that they would ever need any kind of surgery. They should be dealt with, simple, modified loading, and that should not be an issue. And the other thing with kids, remember the other pathologies. You know, we do occasionally see the nasties, so think about inflammatory and think about the tumours.